What is going on, guys? Welcome to another episode of the Masculine Health Solutions podcast, where I'm joined by Joe Bhakdi, who's going to basically give us the lowdown on how AI can basically be used to our advantage when it comes to our health. But Joe, first and foremost, how are you today, sir?
Pretty good. Thanks for having me.
Oh man, it's an honor. And honestly, I want to get your backstory into what got you making this connection between AI and health, man. How did you position yourself, and how did your life basically bring you to this point? Because it's a very interesting topic.
It's a long story, and it's all started when I was zero, when I was born. I was born in a very medical household. I had like two parents, my mom and my dad, who are both very passionate life science researchers and doctors. They were at Max Planck in Germany, which is too complicated to explain, but that's where the research happens in Germany.
Yeah.
It's a institute. It's like a network of institutes that have kind of the best brains in Germany to work on all kinds of issues, but also medical. And they were both in microbiology and cellular research in clinical use. So I grew up in this household, and from 0 to 19 at home, I got like every dinner conversation was about membranes and alpha toxin and cholesterol and all kinds of things and antibiotics. So I got like a first very close up view. I grew up in that world of how does medical research actually work. And also my dad was in charge of the microbiological departments of one state in Germany. So I saw all these complicated cases, mostly where primary care physicians messed up and people died. So I was always on the back end of seeing how medicine goes wrong, because all the complex infectious disease cases came to him. And he was telling us about, oh, this happened and this happened. Oh, they didn't ask the right questions. They gave the wrong medications. So maybe I have a little skewed perspective on medicine because of that, because for me, medicine was mostly cleaning up other people's messes, which is a skewed perspective, but that's just what I experienced. So even though I have great respect for physicians everywhere and they're doing mostly a great job, but there's also a very big problem that no one wants to talk about: medical errors, all the stuff that goes wrong every day. And I mean, one statistic is just 600,000 Americans die every single year, avoidable deaths. Technically, that's a failure of medicine, because avoidable means you need to invent nothing new in terms of hard medical technologies. This is all present, but it's being applied the wrong way. And that includes preventative care, which leads me now to my passion for medical intelligence, right? I then studied actually economics, did some quantitative finance things, because I thought, what about the money? Someone has to pay for all that stuff. But I was always curious about medicine. But there's an organizational and theoretic piece to medicine that doctors don't learn about, like how does the money flow? Who finances this? Why do we pay for certain things and not for other things that are all medically sound? What about incentive systems and stuff like that? And now it came all, circled all back over the last few years that I got into genomics. We founded a great company, Quantgene, that does all kinds of complex genomics work. And in genomics, the problem of medical intelligence, which means making sense of data in medicine so you protect lives and patients, which is the biggest gap in medicine. Where is the medical intelligence? Why do we make mistakes when it's unnecessary? In genomics, it's especially pronounced because genomics is so complicated, so much data, and so new, and no one is trained in it. No physician gets a genomics education. And all of that led to the creation of Serenity, which is our medical intelligence solution in preventative care for all patients to actually understand what's going on with them. And of course, that coincided then with the AI revolution that's happening right now, and that's a very important piece of the equation. And the vision here is very simple. Can you create a portal where patients just go to, they enter their information, and it tells them what's wrong or not wrong with them, and in a way that no doctor can do, but in a much, much more comprehensive way, considering all data points, the entire medical literature, 32 million publications, all textbooks, all the latest guidelines across the world. That's like millions of times more knowledge or data than any physician can carry in their brain. That is the future, because what we don't want is you going to a physician or going somewhere or having symptoms, or prevention, right, where you don't even have symptoms and you just want to know, what do I have to do, and having any gaps in your care. You want to make sure there's total medical intelligence on you. So we tell you, don't do that, do that. Don't take that drug, take that drug. Change the dosage here. Or telling you, you need more information. You need to do the following blood tests or imaging or genomics in order for us to even make an informed decision. So medicine is not just looking at you and making a decision. It's also looking at you and saying what data points are missing, what tests do we need to conduct for more certainty, how do they play together, and then make an informed decision and then go from there.
That is, wow. That is super interesting, because the one thing that I found really captivating about what you just said there is you're basically taking all the data that we have in medicine, combining into one and making it this perfect formula. And you are taking the individual into consideration, which is something that I think is probably, I mean, even from your perspective, you probably saw that it was lacking because a lot of people would make generalizations, right?
Of course. I mean, that's in preventative care, for example. We have all these guidelines when you should get cancer screenings. Let's take one example. Like, okay, women over 21 should get this and that, should get pap smears every 3 years, whatever it is, right? Or mammograms starting with 40. Well, says who and for what kind of patient. And then you have other guidelines that a lot of primary care docs are not totally familiar with, right? If you're at high risk, you need more screenings because your odds of having cancer is much higher. Okay, so if you have a patient that is high risk and you bucket them as regular risk, you're already off. You're already doing something wrong. Mm-hmm. And how often does that happen? Well, in 90% of cases that happens of the high risk patient, they're misclassified. Why? Because the doctor doesn't know they're high risk. Because how would you know? Well, because you need genetic testing. Okay, then there's another rule. Under what circumstances is there enough suspicion to conduct a genetic test to determine that someone's high risk? Well, yeah, there's a set of rules, but who knows these rules? Does your primary care, your OBGYN know these rules? Did they? And then there's more data you have to get before you can make this decision. Did you ask the patient for their family history sufficiently? Because that's the trigger point. Did you ask them if their aunt and their uncle and their grandpa and their mom and who had OBGYN cancers? Do you know the latest guidelines? Like, what if 2 aunts had breast cancer or 4 aunts, but not the mom? Okay, and not the grandma. So is that then high risk or not? So all these things are, everything, the devil is in the details. And this sounds like too many details, but when it's you or your wife or your mom or whoever, then it's just not funny, right? This should not be missed. And this is all known medical science. Just do it right, and you will save hundreds of thousands of lives. And no doctor can do it right because it's just too much. They need complementary AI systems that do that for them. Yeah. That's why we did Serenity.
No, that's honestly, man, it's pretty mind-blowing because, it's like you're taking all those data points. And like you said, I don't think any one doctor can really look at any individual and really figure all this out because we are all different jigsaws, I guess. And it's kind of like we're putting all the pieces together to really make it make sense. And I guess that's where Serenity comes in to really, solidify the fact that, hey, we can put this puzzle together, but we got to make sure that we can do it in a way that makes sense. This is conducive to the result that we actually want. The way I kind of interpret it too, it's like having like 50 different opinions in one spot that kind of makes sense because it's taken in so much data from so many different places. But that being said, the one question I have now, because that also ties into the 20 questions, right? Specifically, what are these 20 questions looking for when it builds a profile up for a human being?
So the way we designed these systems is there's a commercial component to it, because if we sell you on Serenity Complete, which is an annual precision screening that does full body imaging, it does full genomics, and it does full medical intelligence, that costs you roughly $5,000 or $400 a month, roughly. So not everyone can afford that. Actually, a lot of people can, right? Roughly 20 million people easily can in the US, but then 300 million have a problem with it. So therefore, we decided we need easier to access programs too, where we maybe don't do all of the precision diagnostics right off the bat. And we created Serenity Foundation, which is like a kind of a $50 per month product or $500, $600 a year, where you get full medical intelligence without these advanced diagnostics. So we basically answer a ton of questions. And Serenity Foundation is a ton of questions to actually get your profile right. And then you have medical review and a one-to-one session. And you will learn all about, okay, where do I stand? What's going on here? Including if you have symptoms or diagnosis before, or just preventative, whatever your case is. And then we invented also a product that is even leaner and that we are actually giving out for free. So everyone can get base intelligence. And that's the, can these 20 questions save your life? TM, I always say. Like that's the product 20 questions.life. And that is basically a further reduced versions of Serenity Foundation, where you don't get a physician review, you don't get the full counseling because it costs money. So we want to make it free as an entry point. And it's a little less detailed because we wanted to make sure people can actually answer 20 questions. Technically, it's 20 like mobile sites of questions. So it's a little more questions, but it's 20 categories of questions. And now we get to the point why this is so, why did it take a whole team of us to build that stuff? Why can't you just go to ChatGPT or something? And the answer is, when I say medical intelligence, that doesn't equate to artificial intelligence. Even though AI plays a major role, it's not, you cannot do that just with AI, right? You need to have very smart piping in the cloud. Like, what are you actually asking? Why are you asking? And who controls this to make sure there's no mistake in here? And you cannot just ask ChatGPT, it's going to tell you the wrong answer. So medical intelligence needs to be bulletproof, right? When you answer the 20 questions, you will get a dashboard and a guiding system that is correct. Because if it would not be correct, we would be in big trouble, right? We cannot tell people, oh, you were late to a mammogram or do this diagnostics and be wrong. So that's a whole different type of medical intelligence system that is like more bulletproof than an AI system alone. And you basically answer the base questions that we determined are necessary. They're informed by guidelines, right? So the medical guidelines make certain decisions if you need certain things. And in order to make these decisions, they have clearly delineated data points, what they need to make these decisions. And so we basically reverse engineered that. All the guidelines and what are all the data points to actually feed these guidelines to make these decisions finally. And so that's how we reverse engineer the questions and then make them digestible, make sure they're still compliant. There are all kinds of redundancies. So the engineering is a little complicated because you can't make mistakes. You can't just bullet points and then. But I mean, it's a very good user experience in my opinion. It's very easy to answer the questions, and yeah, it helps you to immediately see where you stand. Like, are you fully protected or not, based on like hard medical guidelines?
That's super interesting, man. And to your point about medical intelligence, because yeah, I think we've all kind of messed around with chatbot GPT and all that kind of stuff, and it's very broad, and at times it misses the mark completely, you know, because I've gone on there and just looked at different things and different components and asked things, and it's very generic. It's not going to give you a detailed version of what you're actually looking for unless you know how to prompt it very specifically. And to your point about using AI as another tool, I think that's the one thing that's missing out when it comes to AI. Is a lot of people think, oh, I can use it for everything and anything, but it's just super broad. It's like, sure, it takes in a lot of data, but it's kind of undirected data. So it just kind of like spits out this like potpourri of randomness, which nobody is really satisfied with because it doesn't really answer the question. But to your point about having that direction to it and taking in the specifics, and obviously, I guess you guys are kind of reworking the algorithm every single time you update it too, right?
Yeah, I mean, when we talk about the intelligence architecture, especially for Serenity Foundation, for the 20 questions, we kept it very tight because this needs to be a fully automated system to be free. That is never wrong. And in order to get there, you need to tighten up the screws and you have to reduce complexity. So this is focused on preventative care strategies, right, that are fully US guideline based. And that's it. So you cannot tell the 20 questions, I also have tummy pain. And I also have a weird finding on my whole blood count. And I also have that diagnosis, I have a benign tumor in my pituitary gland or something. 20 questions is not going to take it. There's like, well, good for you, but I'm not going to say anything about that. Whereas in Serenity Foundation, we have a full-scale medical intelligence system, right? You can tell it anything. And we make, in nearly all cases, most sense of it than most doctors, other than our own doctors, of course. I mean, our doctors will get it, but there we have a much more advanced, much more open AI system that basically can take in any kind of information, connect the dots, and give us differential diagnoses and downstream recommendations. But of course, we're not giving that to patients, right? That goes into our medical group and our medical intelligence unit. So we have a medical intelligence unit that just does that. That's a new discipline we invented, right? So we have medical intelligence officers. They sit on our AI systems. They review your case. They make sense of it. They write it all up. But then they send it to the medical group. The medical group reviews it and says, are there any weird things you're saying here? Is this all medically super sound? And if not, it goes back in with comments and say like, well, we can't say that. We can't say that. There are these and these. So there's a sanity check with medical professionals, but there's also a huge medical intelligence component where we can see much, much more. And the systems that feed that are large language models, and they are, we basically customized them and gave them some more deep understanding of medicine, which basically means like all kinds of publications and textbooks and all kinds of stuff you have to actually buy like commercially and like feed the system with it. So when you ask medical questions, you get high resolution responses, right? You're on Keytruda and you have this type of cancer and you have, it's triple negative breast cancer and these are the genetic findings. What is the exact cycle of chemo treatments that is recommended? Like things like that. So ChatGPT is going to be a little weak on that.
I don't think it would even be accurate, to tell you the truth. It'd probably just give you something very broad. But in regards to that too, because if you're finding out somebody's profile, would you be able to make recommendations as far like almost from like a nutritional standpoint, or be like, hey, you know what, you lack vitamin, I don't know, B12 or something, you could be using this, that, and the other. Are there nutritional guidelines that it would actually spit out for a person as well, or?
Yeah, we have to be always cautious because especially in genetics, we got used to all these consumer companies and they're telling you all this thing, don't eat vitamin C and you can't digest kale or whatever. All of that stuff might just not be true, right? That's the problem. Like there is a whole, it sounds great, it's a great consumer experience, but is it true? So there's a huge difference between deep medical companies like Serenity and what Quantgene does and these consumer-facing genetic companies, because they might make your experience great and it sounds all great, but is it true? Like what about the scientific side of it? And when we do things, we just need to be right? There needs to be clear clinical evidence, significant levels of it. The entire practice of medicine, there's all kinds of things you need to understand. Right? This is not for beginners, obviously.
Yeah.
And we basically introduce that level of discipline into everything we do because it's medical practice what we do. And so we shy away a little bit from too shallow recommendations that just might not be true, even though that sounds great.
Yeah.
And because everyone wants to hear, oh yeah, you can totally benefit from omega-3 and don't, reduce your sodium intake because of your genetics. It sounds great, but like no one knows if that's true. What is true is everyone can benefit from that. So we give people nutritional advice because one of the most common problems you find actually is hypertension, high cholesterol or lipids are off, A1C is off, and people need to go on a fasting regime and clean out their nutrition to just get these core biomarkers down. That's actually medically very sound, and we are investing more into nutrition guidance because that is very important. That's a weakness of medicine. But it's not like saying, oh, we found this genetic variant, therefore don't eat fish or something. That's not it's more like, here's the big picture. Here are your core problems medically. Here's your risk and your trajectory. You're going to get diabetes or you're going to get cardiovascular conditions if you don't turn this around, if you don't turn these markers around. And then we say, here's a nutritional and exercise strategy that is proven to actually help you. And then we have these packages you can buy where we say, like, do you want a coach? Do you want someone who calls you once a week to get through the nutrition with you? So that's what we are building up more, because in the end, it's all about medically sound and precise advice that is proven to work based on findings that are clear, and then guiding systems and guiding infrastructure for the patient so you can actually do this stuff. We don't say, oh, good luck, right? Just figure out how to eat better. That's not going to work.
That's very interesting too, because I've had other guests on who are talking about approaching it more from a team-based approach as well when it comes to medicine, right? And how you got to look at the different factors that play into it. And it's interesting how you brought up the whole coaching aspect as well, because that's one thing that I find in regards to medicine, it's kind of always been siloed off. Like this guy's a specialist here, that guy's a specialist there. And it's always kind of been separate. And it's one of those things that I think has led to a lot of confusion, to your point earlier about how, we've had about 600,000 mistakes made that costed people them basically their lives, right? And I think with a system that's more integrated into lifestyle and obviously involving different things that actually make sense, it's going to give you far better results. So, as far as screenings kind of go, how does that play into preventative healthcare as well?
So when you look at the medical piece of preventative healthcare, this is all about screenings, right? That's the main thing you can do. So screenings are very life-saving in the sense that it's the most proven method to actually protect your life. When you look at cancer, for example, cancer is kind of a problem because even if you have the best lifestyle, you're reducing your risk of cancer, like not by much, actually. If you have diabetes, you double your risk of cancer. So not having diabetes is a good idea, but just eating a little healthier or avoiding red meat, if you look at the statistics, that's not moving the needle too much, right? So you can maybe reduce your cancer risk through these kinds of measures by some unknown, maybe 10%, but you can be the healthiest person on earth and just get cancer.
Yeah.
And that's why, over 1/3 of all people get cancer in their lives. That's a statistic that no one wants to hear, but that's just what it is. And it's a little scary. That's why cancer is the #1 cause of death in the age group from 35 to 75. So where it actually matters, where it really cuts your life short, it's cancer, not cardiovascular, that kills the most people. And that's why everyone is so scared of cancer. And when you look at all the things you can do in cancer, for like modern treatments, blah, 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 to all kinds of stuff, there's only one measure outside smoking, don't smoke. There's only one measure that really moves the needle, and that is early detection.
Yeah.
Right? If you look at breast cancer, colon cancer, lung, all the deadliest cancers, detecting them in stage 1 in many cases gives you a 90 to 99% chance of survival. And detecting them in stage 4 puts you into 10%, 5% survival chance. And think about what that means. Like,
Yeah.
I mean, that is a pretty devastating differential there. And so it's kind of not really discussed too much in public. We have these big screening guidelines because of that and spend billions of dollars on screenings, but we spend trillions of dollars on treatments, right? So for you personally, I always recommend to people to understand this math, that these diseases are not like wait until you get the disease and then do all kinds of magic treatments. That's not how it works. You're in bad shape at this point. This is a probabilistic problem throughout your entire life. It's an area under the curve. You have 40 years or 50 years or 60 years to live. You need to make sure you have maximum protection throughout that time span. And protection means you need to intercept these types of diseases, neurodegenerative, metabolic diabetes, and so on, cardiovascular and cancer. You need to intercept it at the earliest stage. That is what makes you not die. Nothing else. Yeah. Like, of course, being healthy and on metabolic, that's also very important. But other than that, nothing else keeps you really alive. Like, what keeps you alive is you need a web of annual precision screenings. That's what I see as the future, that makes sure you can't get these diseases late stage. And then you would basically reduce your risk of death by roughly 50% in that time, that age
Interesting.
range.
And let's say with 20 questions, would you be able to, because the way I kind of see it, I think you're 100% right, because that's kind of one of the biggest issues that nobody wants to talk about is like, hey, you know what, it's a real dirty thing. Let's just sweep it under the rug and hopefully I don't get it. It's kind of like we're all playing cat and mouse, and I see it all the time everywhere, and even out where I work too, there's guys where it's kind of like, it shows up there. It's not like it doesn't exist, but we all like to pretend that it doesn't because it's not a part of our lives. And a lot of people brush it off as one of those things like, oh, it won't happen to me, it won't happen to me. But we all know somebody that's died from it. That's kind of the irony of it, right? But
Yeah.
to your point, in regards to prevention and stuff, would it be possible to almost keep it at bay for the rest of your life if you had the proper, let's say, screening or preventative measures kind of in place to make sure that you're pretty much good just from doing the 20 questions and following up with that every single day?
Well, of course, there's a reason why Serenity Complete costs $5,000 and the 20 questions are free and Foundation costs $500. It reflects a little bit. The 20 questions are a big needle mover to really help you for free to get this under control. But of course, it's standard of care screenings, right? There is right now, no physician, no primary care doc can or recommend screening for pancreatic cancer, for liver cancer, for kidney cancer, for lung cancer, even for non-smokers. So for leukemia, so even for melanoma. So the screening regime we currently have in place, the 20 questions reflect standard of care. right? They do what is officially the guideline in the United States for preventative care. We know that this is the stuff that is the most cost-effective and most widely recognized, that you just need to do that. If you don't do that, you're just not in good shape, right? So that's what the 20 questions do. And so that is a great starting point, especially if you don't want to spend money, to just make sure you do whatever you can that is in the standard of care. Now, if you ask me, I'm doing Serenity Complete every year, of course, because I'm not going to take any risks. Like, I want to also know if I have liver cancer, because that's killing you even faster, only that it's less likely to happen than colon cancer, which is so basically, if you spend more, and we brought this price down dramatically, right? Anyone else who does these kinds of things charges you 20, 30,000 bucks for this. So we brought it down to 5,000. That's what we believe should be the gold standard, the highest standard of screening. If people can't afford it, the 20 questions get you the baseline in that the United States, basically everyone pays for that, for these kind of tests. But they leave out a bunch of key cancers and also a bunch of other conditions for cost issues, like the healthcare system. So you have to view it like that. The 20 questions is much, much better than not having the 20 questions. If you can afford it, I would go to a Serenity Foundation and say, like, why not having a full review, a physician, and also like go a little beyond just prevention and see anything that might be there. And if you can afford like $400 a month, don't skip that. Just do a full body MRI scan and do a full genomics cancer detection thing once a year, because you want to just intercept these signals early.
Yeah. And I mean, to your point, it's kind of funny that you were telling me the numbers, and I'm like, I'm pretty sure that all pales in comparison to actually suffering from one of these diseases and what you have to pay, right? And I find it, because the more I read into this, it's kind of like obesity, diabetes, every other metabolic disease involved, cancers, all this stuff is just crippling, and I live in Canada, right? And even our economy is getting hit hard because, I mean, all these things are so awful, but they come at a very high price, which is why it's kind of something like this. Are you guys looking to find a way to integrate it with the health insurance in the United States and Canada, or is there any way that, you guys could get that going? Because I mean, I think preventative care would be make a lot more sense.
This goes deep into like a bigger discussion about the future of healthcare. And we believe a lot of people bash the American system because when you look at the face value compared to Germany, Canada, like other places, everyone has their own system. Germany has this hybrid system where it's like half private, half public, which is probably one of the best solutions, but still bad. Then Canada is very single payer. That has a problem. And then the US is just wild. I can't even describe it. It's kind of very corrupted, lots of lobbying, lots of weird constraints by the government, but then also wild capitalism mixed into that. So it's like a weird, it's definitely not free market. It's definitely not socialized. It's some weird thing.
Yeah.
And that has terrible consequences for some people, because you can get these crazy invoices here, get a blood draw, and it's like $3,000. It's 50,000. No one knows why. But in Canada, you have these wait times, you have a lack of innovation, so everyone has their problems. And the reality is, to cut it short, like the whole story, the only way to get the future of medicine engineered is through an entrepreneurial activity and through self-payers in the beginning. If you don't pay out of pocket for this stuff, you're already in deep trouble, because the problem is the commercial insurance or government, they have totally different interests from you. And that's like what people have to understand. It's not hard to understand. If I am an insurance company, I have a goal, and the goal is to deliver profits every quarter. Like, where in that equation does your life come in? Well, it comes in the sense, like, don't spend too much money on this guy. Like, minimize expenses. That's the design of health insurance companies. How is that in your interest? It's just not in your interest.
No.
If you're the government, the government is a little better incentivized, because they're not going to escape their responsibility. So, for example, preventative care. We know some is life-saving. We know some stuff is even cost-saving. The commercial insurance doesn't care, because for the commercial insurance, the median dwell time or stay time for a patient in one plan is 2.5 years here. So what are the odds, if you have all the spend on detection, early detection, that pays off? I tell you, the odds are roughly 0%. because either you don't detect anything, then you wasted your money on doing stuff that doesn't detect anything, or you do detect something early. That's a total waste of your money, because that person would have gotten cancer probably after they leave your plan. So not only did you never have these bad costs, your competitor would have it, but also you incurred now early treatment costs, like an additional 50,000 for early stage cancer treatment. So you're just front loading costs and not offloading long-term costs, because you wouldn't have these costs. You only have late stage cancer patients you unfortunately get now in your plan, but early detection doesn't remove them because they're already too late. So there you have a real capitalist problem, because there's zero incentive to do anything. And then for the government, they say like, oh, isn't it smart to do early detection? Well, yes, to some extent, if it's cheap. But if it's expensive, that's a different equation, right? There's all kinds of economics behind it. If you spend a certain amount of money in average, it's like this $50,000 quality thing, like quality adjusted life years. So basically there is some implicit thing. No one wants to really talk about it, but all the academics say that's basically the decision threshold. If the extension of life, of a full quality life year, so quality adjusted life, so you're like fully healthy, or like 2 years when
walk.
year, one quality. There's a price tag on it between $50,000 and $100,000, more like $50,000. If that costs more than $50,000 to achieve that, you're getting clipped. Like they say, it's just not worth it. And the 50,000 could mean, for example, spend $50,000 on screening 1,000 people, $50 each, to save one person, or to extend one person's life in full quality of life for 1 year. If that's the case, that's the of you say that screening is not worth it. And now from your perspective, how many people in the United States would say, if you buy me 1 full year of life at full quality, would I spend 50,000 or 100,000 or $1 million on that? You have millions of people who would spend $1 million on that. So there's a disconnect. They're making decisions that are not aligned to your value of your life. And since no one understands that stuff, the scandal is like not that big, but a lot of people who are rich in the United States, they have concierge stocks because they kind of understand. It's like, well, they're just going to clip me and I don't want to get clipped. And I'm willing to spend 100,000 per year to not die. Once people become fully aware of these equations, they understand, okay, do not rely on the government. And in Canada, don't get me started, same thing. I mean, they're going to $50,000, goodbye. Like, and that's not, no one wants, it's a very uncomfortable conversation, but that's just the fact. And this whole thing, oh, healthcare is a right for all. It's not about rights. It's about who pays for that stuff and where do these resources come from. There's no right. There's like, we need to make it work. Otherwise, it just doesn't work. And then people don't want to talk about it and say, oh, this is so bad. And then what's the solution? Well, not have any progress for anyone because some people can't afford it. So let's all die. That's like, we need to start somewhere. And I think the right move is do the best in technology to make these things much more affordable. Have wealthier people pay for better protection. They help us build the evidence and get scale. We can bring down the price, become more inclusive. We get more evidence. And at some point, we have the price so low and the evidence so high that we can do a public campaign to force government, insurance, Medicare to actually adopt it. That's the only way to get this done. There is no debate and backroom deals. You can only do this fully in public. Do it with people who can afford it. Bring down the price, create more evidence, and create increasing public pressure on getting these systems and lower prices so it becomes digestible for governments to get that done. And the last piece of the equation is commercial insurance, because they will move last. They will move after Medicare.
Interesting. No, it's kind of, I mean, a lot to digest, but it makes perfect sense. It's kind of like right now, the way I kind of see it is I got to act as a singular entity anyways. So I got to take my life into my hands and I can't really rely on anybody. And I think a lot of people, like not just in Canada, but in the States as well, are always kind of looking for that government handout or for somebody to really fix their issues. But at the end of the day, it's kind of like lifestyle choices. Like ultimately it boils down to you. And now like on this show, the guys that listen to the show and everybody that's, paying attention to this is we're all really looking to move the needle for ourselves because we're just kind of like, okay, we want to make sure we're healthy. We're one step ahead of the curve. However, for all the people that want to stay behind, unfortunately, you got to rely on these systems that they have in place But to your point, the disconnect lies in that is that they don't value your life. And it's true. It's like even here, they started introducing the assisted suicides or euthanasia, I think it was, where it's kind of like an easier way. It's like, hey, you can suffer. How about we just, send you to the next dimension? And it's like, all right, cool. I'll just get
And
that.
that's very socialized medicine, right? It's not that they don't understand the numbers, they understand the numbers very well. Like,
Yeah.
okay, assisting, like keeping that person alive costs us $150,000 a year. We have 10,000 of these people in Canada or 50,000. They do the math like, oops, that's a few billion. Maybe
Mm-hmm.
assisted suicide sounds like a great idea. And I tell you, this is not just driven by ethics, it's also driven by very unethical considerations. And you can't even blame people. I mean, in the end, money is money. Like, even though
Mm-hmm.
everyone thinks it's dirty and, oh, a human life, in the end, someone has to generate the money. And if you don't have the money, it's game over. It's like, what are you going to do? And this is all very complex. The good news, that's my message to everyone. The good news is don't make it complex. Make it about you. And if
Exactly.
it's about you, don't hope that Trudeau or whoever, or Trump or Biden or whoever is in charge, if you think, oh, I'm outsourcing my health to the White House, you're just nuts. Because
Mm-hmm.
guess what happens next? You're just gonna die. And we have to learn that we are in charge of our bodies and health.
Yeah.
Like, that's the end of the story. And if you, it's like everything in life. It's like outsourcing your finances to the treasury or something, right? They're not gonna help you get rich. They just don't care. And it's
Exactly.
stupid, and everyone gets, like, I need to work, I need to save, I need to invest smart. If I do stupid stuff, I'm gonna lose my money. Well, guess what? What's more important than money? It's your health.
Mm-hmm.
And if you think you can outsource this to your doctor, even your doctor, or to your insurance company or the government, you get killed. I can guarantee you that. So
Yeah.
you need to understand, you need to take care of this. You need to find solutions like Serenity or the 20 questions. We try to make it as cheap or free as possible, where you have entrepreneurial teams like Quantgene, like, Serenity, or other people who try this, and just make up your own mind and view it as any kind of product, only that's the most important product in your life because it's your life.
Yeah.
And just, listen to me, listen to other people, and cast your own judgment. Do you think Joe is crazy? Then go to the next guy. Or do you think he says interesting things? And look at his stuff. Like, just treat it as something that you have to deal with, and try to build your own solution where you have trusted advisors, systems, platforms, doctors who you think listen to you, are smart advisors. Emphasis on advisors. You are the CEO of your own body and health. You make the
Mm-hmm.
decisions, not the doctor.
Yeah.
And you expect your doctors to feed you the right information and be smart consultants and experts. And if they are not, then switch.
Yeah. But no, to your point, it's kind of like that's the best way to look about it is, yeah, the one thing that will always trump everything else in this lifetime in our human bodies is our health. And for me, it's kind of like I see it as a no-brainer, 5K versus, 150K, 100, 200K a year that you could possibly be paying for chemo and all these other different, you know, I'm gonna call it reactive medicine because that's kind of what I feel the system is right now. It's always
Yeah,
reactive. And to your point, it's kind of like it's not in their best interest to be preventative. And now, from economical kind of standpoint, I'm like, well, it makes perfect sense. It does not serve them in any which way to be preventative at all. Which is the one thing that we are all looking for as individuals, which is the tragic irony in this situation, right?
yeah, exactly. And that's, yeah, I think that's why podcasts like yours are great, to have these discussions so people get a little red pilled or whatever you call it, like that they understand.
Yeah, a
They're
little bit
all
of
telling
truth.
you, oh, yeah, it's like, oh, human life, we want to protect it, and the system, we want to be socialized medicine, blah, blah. It's very simple. It's always about money. And
Hmm.
the advantage of capitalist systems, which they're not super corrupted, which they are a little bit in the US, but the government is also involved. In the end, you just have to understand you have to take care of your health. It's going to cost money, and being sick costs you much more money. And if you think you can close your eyes and outsource it to some insurance, it's not going to happen. And also, it's going to drive up the costs, so you pay actually more in the end,
Hmm.
indirectly. And I think, people just have to understand that they have to come to grips with the fact that, especially in preventative care, this is an uncontrolled system, right? They're not paying attention. And that's your key lever to stay healthy. And you need to own that problem. And you need to find solutions that help you own the problem. And it's going to cost a little bit of money, but not crazy amounts. I mean, Serenity Foundation is a $500 per year product. So that's like $45 a month. So you need some form of starting, or 20 questions free. Start there. So I think that's my message, like that everyone understands. Number one, prevention is the key to not getting these chronic conditions. The chronic conditions are 80% of all deaths. So that's your problem. Prevention is the solution. And within prevention, screening and detection is the biggest needle mover besides lifestyle and being in good shape. But that's related because these people will tell you that. So that's a related thing. And your primary care dog is probably not doing the best job because they have many issues, right? They don't have the technology, they don't have the time and attention, they don't have the, patient guiding systems. They can just meet you once a year and tell you something, and you need to upgrade. That's what I would recommend.
Yeah. And that to your point, no, I think it makes perfect sense. And it goes back to the individual because, I'm a coach and I tell people how to eat, what to eat. And when I'm working with people, they're receptive because they paid for it, which now means that they have a contract with me and they want to do what I tell them because it's kind of like, hey, I invested in you. I want to follow your directions. Now, when you put this out into the general public, and I'll just tell people when they ask me about, hey, I want to get in shape. What should I do? How long will it take for me to get abs? And I'll be like, you're going to ask me and you're not going to apply absolutely any of it, and I know that because I know a lot of people just kind of want to hear the information and will never apply it and never spew it. My hope is that the people listening, will obviously take this into consideration and say, hey, preventative medicine is, because I kind of feel like we're shifting out of an old system. And I feel like preventative medicine is one of those things that's really going to be on the forefront of where we're going now because it needs to be, I think. But I also feel that goes down to the responsibility of everybody as a singular person, as a singular organism. It's kind of like, do you want to take responsibility or do you not? Do you want to keep relying on somebody else on a broken system, right? But I really hope that, everybody listening, hey, go to 20. I'm going to make sure I got all the links in the description for sure. But I really hope that this is going to be the way medicine of the future, because I think it's the only thing that really makes sense if we want to live longer. I mean, if we want to keep dying the way we are, then, the current medical system in place is just doing a fantastic job.
Yeah, absolutely. I think, that's what has to happen. I mean, I'm not that pessimistic. I know a lot of people say, oh, people are just not going to listen. We have to, we have to view it more like any other product that you're launching. Some people want it and some people don't want it. I think it's that simple. The people who want it really want it. And then if people don't want it, I mean, they're going to pay the price in this case for it. And we should be very clear on that, but we can't force anyone to do anything good for themselves. Just say, you know what, it's a wild west out, whatever. Like, just make sure you don't die. And if you don't make sure you don't die, you're probably going to die.
Yeah.
I mean, that's your choice.
No, yeah, and 100%, man, because it's kind of, you can do what you can do, and that's all you can do, right? And I mean, you could bring all this light to the masses, and obviously, like I said, I think it's going to grow in popularity in the near future because I think a lot of people are starting to recognize that the system that we have right now is not working, right?
Yeah.
And that's kind of where I'm like, I think everybody that you talk to will be in agreement about that. Whether they want to discuss money or not is kind of like a different issue. It's like, ooh, I don't, but I think everybody now is in agreement that what we're doing right now is not working. This reactive system is not working. But the one question that I want to leave you with, well, before you leave, is what do you see in the evolution for your company and where you're going in the future? Like, where do you see all of this kind of really evolving to this next step?
I mean, we have a very clear roadmap here. The concept of medical intelligence, right? The concept of generating the right data in medicine, getting it into kind of medical intelligence engines that make sense of it, and then feeding it back through guiding systems to patients to tell them what to do, either to generate more data or to put them on a certain plan. It has such an unlimited, enormous upside. You could save literally hundreds of thousands of people each year in the US alone. And there's no doubt about this. This is like crystal clear. No one contests that, actually. And I think with Serenity, we have the leading system now. We are the first ones who actually got this to a point where it starts to really work. And when I look at the trajectory of AI and how our AI systems improve and our knowledge of the workflows and the medical integration, the goal is very simple. Like, can we get this to a point? It's all about cost per report or cost per feedback, right? Right now we are internal cost, whatever, we are like at $400 or something in average. If you can get this down to 300. So the future we see here for medical intelligence is very straightforward. The central problem of medicine is that this intelligence piece is missing. So what you would like to see in the medical system is every interaction with any patient across all medical disciplines, including preventative systems, but also deep into oncology, cardiology, the whole thing. There needs to be a medical intelligence layer that makes sure there is no wrong decision being made, and that makes sure all knowledge is being considered by every physician every point in time. All preventative guidelines and preventative measures are being applied to all patients at any point in time. Once you have a cloud-based AI system that does that, it's not even hard. You just integrate it into the workflow. The savings for that will reach into the trillions per year. Just doing that and avoiding all that stuff that's happening. It's going to save, we estimate 1 million people per year in the US alone, 600,000 in this early age group, and then 400,000 probably later. So the question is, how do you develop the system? And I think we are the company that is actually the only company getting close to that or already deploying something, because we don't have a tools first attitude. We are not like Google or something and invent some AI thing and say, here's your AI, because that's not going to work. We come from a medical solutions perspective. We are very AI focused. We use a lot of AI, but it's also about the workflows. It's about the guidelines. It's about other cloud systems and hard-coded logics. It's about understanding what new types of people medical intelligence officers have to do, what medical doctors have to do in this whole new workflow. It's about training your own systems to be error-free, which ChatGPT is not, and large language models. And so our goal is build Serenity as a product, as we do it now, but drive down these costs. And the central KPI is cost per transaction, like cost per medical review. Is that $500, which is roughly now $400, $500? Can we get this to 50 cents? Which is like not unheard of in computing stuff. Like, that's easy once you crack some codes. But it's going to take some time. It's going to take hundreds of thousands of patients we handle to drive that systematically down. Can we get it from $500 per report that we generate to 250 to 100 to $50? And can we, with not just without compromising medical quality, but by increasing medical quality? That's the central KPI of this whole thing. And this is by enormous distance the most important thing in medicine. Like everything else, any drug, any policy change, like this all pales in comparison to medical intelligence. Medical intelligence is the thing that can save us trillions of dollars and millions of lives if done right. And we are very determined to get it right, and we are already getting it right, I think. Now it's just a cost issue. Like, and that is a very important breakthrough. We are already getting it right. We have to drive down these costs per transaction or per report. And we have to make sure this is universally applicable, which it already is, kind of across most disciplines. And then we are ready to go. And then the vision is very clear. You implement that layer of medical intelligence across the entire medical system, and suddenly all avoidable problems are solved, which are a lot of problems.
Which is something I look forward to in the future that I want to live in, Joe. So honestly, that was the perfect way to end this show, and I hope everybody enjoyed it. But honestly, man, I learned a lot, and I think we all did too. And I look forward to the future now, because to your point, it's kind of like you already developed the system. Now we just need more people to start integrating it into their lives. So I really hope a lot more people jump on, and I believe in your vision, man. And I really see it being a fantastic thing in the future. So that being said, Joe, I had an awesome time. And, hopefully we can talk again in the future to see how things are going, maybe in a couple quarters down the road when you're doing spectacular.
Absolutely. We are looking forward to it. Thanks a lot. That was a lot of fun.
Hey, thank you so much for coming on the show. And to everybody listening or watching, I hope you guys enjoyed today's episode.